Good morning, Mr. Chair, members. Thank you so much for having me. My name is Dr. Megan Mooney. My pronouns are she, her, and hers. I'm a licensed psychologist who specializes in treating traumatized children and adolescents, and I'm the past president of the Texas Psychological Association. I'm here on behalf of myself and the association in opposition to SB 1646. I'm passing out copies of my written testimony. I'm going to deviate from it a little bit just to speak to some of the comments that have been made earlier. You heard from Dr. Hopewell earlier today, who spoke and referencing his past presidency to TPA. And that is true. He is a long-distance past president for TPA. And unfortunately, Dr. Hopewell is not up on the current data and is not in step line with the association in our support of gender-affirming care for youth and their families. Our TPA guidance that we issued in 2019 is based on our national ethical standards from the American Psychological Association, as well as the international standards from WPATH. Our review of the research, as well as those guidelines, stated, transgender children fare best when caregivers and treatment providers establish an affirming and supportive environment within which they can understand their emerging gender identity. Part of creating an affirming and supportive environment for transgender and non-binary youth means developing and engaging with a multidisciplinary team that often includes psychiatrists, endocrinologists, pediatricians, and/or adolescent medicine specialists. To reference, Mr. Chair, your correction to the UK ban, I researched that while I was waiting in the gallery, and my understanding is that currently children under the age of 16 can continue to receive puberty blockers with court permission, and they are allowed to do cross-sex hormone treatment if they've been on blockers for over 12 months. Children ages 16 to 17 are presumed to have the capacity to give consent and only need court permission if there's a reason for concern to make their judgment. Dr. Stewart referenced earlier psychological care being the primary and most important factor in care for these youth. I wish that were true. I wish that my care was sufficient, but I know it's not. I partner every day with the physicians in the Houston area to make sure that I'm providing adequate care for these young people. In summary, SB 1646 has the potential to be a source of trauma for many young people by eliminating their ability to access safe and affirming medical care. I urge you to vote against SB 1646, as this would take away medical professionals' right to practice in accordance with their professional ethics and standards of care, and would increase the potential for a young person to die because they have hopeless feelings and suicidal feelings because they could not receive affirming professional care. I thank you for your time and welcome any questions.
Doctor, thanks for your testimony. Senator Powell.
Dr. Mooney, are there any published professional standards that guide your practice in providing affirming care for youth?
Thank you so much for that question, Senator. Yes, there's a multitude of standards, including coming from our National Association, the American Psychological Association. I also follow the WPATH standards of care for mental health professionals.
And do you have research, or do we have research that tells us at what age children truly have an idea of their gender identity?
It's a great question. We do. We actually have data coming back from the 1960s that children as young as 3 and 4 have a decent sense about the concept of gender, and usually around the ages of 6 to 7, they have what's referred to as gender constancy. So they understand the concept of gender for themselves and others at that point. And so by the time we're talking about gender-affirming medical care with children who are ages 9, 10, 11, they have had a good understanding of their gender for quite some time by that point.
And they have a real sense then of norms.
Correct, yes. We live in a very gendered society here, and we all know walking into any store, you can tell which is the boys section and the girls section by the colors. Our children learn those messages very early. Yes, ma'am.
And as an expert in child trauma, have you had any reason to be concerned that providing gender-affirming medical care has caused any form of psychological trauma or PTSD in any of your clients?
No, ma'am. I've been an affiliate of the National Child Traumatic Stress Network for almost 18 years, and in that time, the federally funded network of treatment and research sites across the country has always recommended affirming treatments for children because there is no evidence that this is abusive or creates potentially traumatic effects in children.
And so then, what would you say are the known mental health benefits to providing gender-affirming medical care to children and teens?
Research is clear that providing gender-affirming medical and psychological care helps reduce rates of depression, anxiety, and suicidal ideation, which is extremely important because, as we know, our transgender youth report attempting suicide at a rate of about 44%, which is significantly higher than their peers, which their national average is about a 4% suicide attempt rate. So this is truly life-saving care.
And then, to be fair to that question, are there negative consequences to delaying the gender-affirming care?
Yes, ma'am. So the research is also clear that when we ask children to delay the onset of their gender-affirming medical care to the age of 18, the rates of depression and anxiety, as well as suicidal ideation, increase over that time period.
Thank you, Dr. Mooney.
Thank you, Senator.
Thank you, Doctor. Thanks for your testimony.
Thank you.